The symptoms of malaria: high fever, headache, fatigue, dry cough, nausea, vomiting, anemia, jaundice, seizures, kidney failure, and coma, often leading to death, has been known for centuries. It was originally thought malaria was caused by something in the air, thus the name malaria from the Latin bad air. These are very disparate symptoms and did not have any obvious connection. There appeared to be no common cause until a French army doctor, Charles Alphonse Laveran, in 1880, observed the parasite Plasmodium malaria in the red blood cells of infected North African soldiers. The common denominator or root cause of malaria had been found. He was searching. He put some red blood cells underneath a microscope and saw some very small little black spots, which were identified as parasites, Plasmodium, named it Plasmodium malaria, and found the cause of those disparate symptoms was a single parasite. Then it took 17 more years until Major Ronald Ross, a surgeon with the British Indian Medical Service, discovered the mosquito Anopheles as the vector that transferred Plasmodium malaria from one person to the next via their saliva. So a mosquito bite injecting saliva infected with the parasite Plasmodium malaria infected a series of people who ended up with disparate symptoms. I want to emphasize the word disparate symptoms, or the concept disparate symptoms, because it's very similar to what happened in the area on the disease that we know as temporomandibular joint disorder, which everybody calls TMJ. You can see there were several cause and effects discovered before the disease of malaria was fully understood. This was followed by studying the cause and effects of several substances or drugs that had the best effect killing the malaria parasite. The whole process of solving malaria was just a series of effects, observations, followed by searching for the cause. The root cause of malaria is the parasite Plasmodium malaria.